Story 1. I had swelling under my chin, and my doctor kept calling it a double chin. I said I'm not fat. I'm actually underweight. Why would I be accumulating fat in this specific place? He said it was genetics. I asked a couple of different doctors, but they were very dismissive. Then one day, my mouth was really dry, and I couldn't swallow anything. I went to an urgent care center and they took an X-ray. The swelling under my chin was actually a tumor on my sublingual salivary gland. I needed major surgery to have it removed. Took 6 months to recover. Keep advocating for yourself. Mine didn't end up being cancerous, but what if I had just given up and thought, oh, I guess I just have some excess chin fat? Story 2. Starting at age 15, I had abdominal pain that was dismissed as everything from a sexually transmitted disease, even though I was not sexually active when it started, to gas or just being in my head. When I was 26, I finally got an answer. I had a large cyst and several small ones on my ovaries. I probably was not the best at describing my symptoms, but the medical professionals certainly did not do anything to try to give me an answer. Story 3. In 2012, I was in Walgreens, stepped on an eyeliner pencil that was lying on the floor, and fell. I didn't think I was physically hurt at the time, but within a week, my lower back was hurting severely. I went to my doctor and he prescribed a muscle relaxer. This continued and my back never improved. If anything, it hurt more. I went back to my doctor and explained to him that I didn't think my back pain was from my fall. I thought something else was going on. He literally rolled his eyes and told me I fell and hurt my back. Nothing else was going on. I told him that my dad had hurt his back and was being treated for it. Finally, after weeks of not improving, they did an MRI and found out it was actually an aneurysm. My sister was also treated for back pain after a fall, only to find out she had cancer. He acted annoyed and told me not to be a hypochondriac. This was the first time I had ever complained about anything to him. He made me feel like I was stupid. The very next day, I had a gynecologist appointment. She always questioned me about my life and what was going on. She was a great doctor and has since retired. I told her about my back pain. She asked where it hurt, I told her, and she said it might be my kidneys. She referred me to a urologist. I had the biggest kidney stone he had ever seen. He told me it was blocking the entrance to my left kidney. He said if I had not come in when I did, I would have lost my kidney. I fired my primary care physician and told him why. Story 4. I have had many, but a friend is having an experience that is heartbreaking. She was suffering severe back pain, with the doctor dismissing it and telling her it would get better, that she probably just needed to lose some weight. She came back some time later with even more unbearable pain. They finally did scans this time and found cancerous tumors that had metastasized. The doctors say it is too late and cannot help her. She has about a couple of weeks left to live. Story 5. It took me over 5 years to be diagnosed with polycystic ovary syndrome and endometriosis. I had horrible, painful periods, facial hair, and met all the clinical markers, except I was not overweight. Because of that, I was repeatedly told I did not look like I had polycystic ovary syndrome and dismissed over and over again. Eventually, I convinced a doctor to scan my pelvis. It was textbook polycystic ovary syndrome. I ended up needing surgery to remove a giant ovarian cyst, and during that procedure, they discovered I had endometriosis too. On top of that, I am high risk for cervical cancer and need regular Papa Nicolau smears and colposcopies to monitor it. I can honestly say it is the most painful procedure I have ever experienced, and that includes getting an epidural too late and having a natural birth. Still, I have not been able to find a doctor willing to perform it under any kind of sedation or pain relief. I keep being told it is standard and not that bad, even though it absolutely is. I deeply feel the frustration and pain of being ignored or minimized. Story 6. You can't have a concussion. Your hair is too thick. I have mentioned this a few times on Reddit when this topic comes up. A doctor sent me home when I was fairly certain I had a concussion because he felt the incident was not severe enough. I hit my head on the cinder block dorm wall to cause a concussion. I returned 2 very hazy days later and fully failed a neurological exam, then was sent straight to the emergency room. Definitely concussed. Story 7. When I was 47, I saw 4 different male doctors for cardiac symptoms. including a cardiologist who ordered a Holter monitor for me to wear. Every single one came back with anxiety, menopause, or some other dismissive diagnosis. I had a 100% blockage of the left anterior descending artery, also known as the widowmaker. I had a massive heart attack and almost died. The emergency cardiology team after the life flight were stunned that I made it. Story 8. When I was 18, I was still seeing my family doctor from childhood. He was not a great doctor, but I did not know where else to go. I had a urinary tract infection and went in to get treatment. I told him I was also experiencing recurring feminine itching issues, and my period had stopped completely for several months. He gave me the usual, "This is your own fault" nonsense and told me I obviously did not know how to wipe myself. So this man, whom I had been seeing since I was 3 years old, gave me a lecture on how a woman should wipe herself. When I told him I knew how to do it, and that this was caused by something else, he rolled his eyes at me and said, "You cannot just admit when you are wrong, can you?" He completely ignored the fact that I had not had a period in months and said, "You are 15 pounds overweight. When women are overweight, their periods stop." He wanted to do a full pelvic exam and I declined. I said I would rather have it done by a female obstetrician-gynecologist, but because of my insurance, I had to get a referral from my general practitioner. He refused and said that he was not going to send me to an obstetrician-gynecologist because they are not necessary unless you have real issues. Again, saying that I just needed to learn how to wipe myself properly and lose 15 pounds. I ended up going to an obstetrician-gynecologist and paying out of pocket. I found out I had a hormone imbalance that was causing some serious issues for me. Story 9. I had stage 3 endometriosis and infertility because of it and had to advocate for myself for years. I was constantly told by women doctors that everyone had difficult periods. Story 10. I had severe back pain as a 45-year-old female. I went to a newly built hospital that was part of a larger chain of hospitals to see an orthopedic specialist. They took x-rays and said they saw nothing. I was then sent to physical therapy, which was impossible to do because of the pain. Basically, I just laid on a bed with hot blankets on me. I then returned to the specialist where they took more x-rays. They said nothing was wrong with me and advised me to take over-the-counter pain medicine. I was not impressed with the doctor. In fact, I am not sure I even saw a real orthopedic specialist. He would hop up on the counter and swing his legs as he spoke to me, with a childish attitude. I came back 3 months later because my back was getting worse and my knee had started hurting. I was told the real doctor didn't see a need to get a magnetic resonance imaging scan done but would refer me to a knee specialist. At this point, I was at a loss because I just couldn't believe they thought I was making this horrible pain up. I went to the knee doctor who was part of a different orthopedic practice. I ended up having knee surgery. I told him about the immense pain in my back. He referred me to another orthopedic specialist in his practice. I went to the new doctor. He did an exam and x-ray. He asked why the other place didn't do a magnetic resonance imaging scan. I told him they said they didn't think I needed it. He ordered a magnetic resonance imaging scan. He called me within days of the scan results to come in. I'll stop here to mention that it had been over a year since I started seeing the first doctor at the other practice. I went to the new doctor. He pulled up the magnetic resonance imaging scan and said, "You have a cyst growing in your vertebrae that is pushing on your spinal cord. We can schedule surgery right away." I cried. After over a year of excruciating pain, it could be fixed. What makes me angry is if the original doctor had done their job, I wouldn't have had to deal with this for so long. Still makes me mad. I had surgery and 3 more surgeries after that because I had another cyst in a different place. 10 years later, I am doing well and have minimal pain most days. I'm glad there is a happy ending. Story 11. When I had my first baby, I got an infection because my waters had broken 3 days prior, and I was not induced for 3 days after that. I developed a blood clot measuring 10 centimeters inside me, and when I told the midwives and doctors that I was in pain, they kept saying it was wind. I insisted that at the age of 26, I know what a fart feels like, and this was not it. They dismissed a large internal blood clot as wind for 6 days until I was admitted to the intensive therapy unit and operated on again to remove the clot. I stayed in the intensive therapy unit for over 3 weeks with no visitors allowed and was not allowed to see my baby, who was only 1 week old when I left and 4 weeks old when I came back home. Story 12. He listens to me now because I have proven that I am well informed. I have an autoimmune condition that affects my thyroid. I can tell when things are off and whether I am experiencing hyperthyroidism or hypothyroidism. During the first few appointments, he suggested that my perception might be opposite the situation, but I kept getting it right. Now, I basically inform him how I plan to change medications if my lab results are off. When we have chronic conditions, we often become the experts. Story 13. My primary care doctor told me I was probably just working out too hard when I described textbook gallstone attacks. I had to piece together what was going on myself and request an urgent appointment with a different doctor about 6 months later to get the ultrasound that revealed my gallbladder was full of stones. Later, the same doctor dismissed crushing fatigue as getting older. I was in my late 20s. The doctor also dismissed a weird feeling spot on my breast, with some women just have ropier breasts. Imagine everyone's surprise when a few years later I was in treatment for breast cancer. I have a different primary care doctor now. Story 14. I had a low-grade fever for about a month straight and decided to go to the emergency room. One of the first questions the doctor asked was if I had a sexually transmitted disease or if there was any chance my partner at the time was unfaithful. I answered no. The doctor ran a full sexually transmitted disease panel before giving me an intravenous treatment. He eventually sent me home with instructions to take Tylenol to lower my fever. It ended up being an autoimmune disease. Story 15. Can I just say I am enraged for women everywhere? When it comes to health, I cannot stand that in the 21st century we are still dismissed. I believe every one of you. Story 16. The intrauterine device will not hurt. It is just a pinch. I vomited from the pain and passed out in my car immediately afterward. Story 17. I had recurring Bell's palsy and was sent to a specialist. This condition causes half of the face to be paralyzed and droop, most obviously when smiling. It was still severe even without smiling, including drooling, a sunken and lowered eye that could not fully close, and the ability to speak only from one side of my crooked mouth. The doctor could not find a cause but advised me to stop smiling. I am sure he had worse cases, but I just remember that for some reason. Story 18. In my early 20s, I had a cough and sore throat for about 6 weeks. I went to the doctor and explained my symptoms. He interrupted me mid-sentence and said, "Your throat is sore because you talk too much. You have been here for 2 minutes and have already talked a lot. If you stop talking, you will get better." I continued suffering for another 3 weeks before I went to a different doctor. They gave me antibiotics and I felt better within a few days. Story 19. This was with a female doctor, and I went in with gastrointestinal issues because I was fed up with being sick all the time. She was supposed to have done research in different diets from a medical perspective and was going to advise if she thought that was my problem. She was in the room for 15 seconds and told me that my issue was not life-threatening, only quality of life-threatening. She did not understand what I wanted her to do and then walked out. I went to the cashier and refused to provide my insurance information, as I would not be paying. Another one. I told a male hospital physician and orthopedist that I was having neck pain and wanted to know why. He told me he would not give me drugs and would not listen when I told him I did not want drugs. I wanted some scans done to see what the problem was. He said something about girls that I do not remember anymore, but I thought, okay, it is because I am a young female, and sent me away. I immediately responded to the text I received asking for a review of my visit. I told them that I felt disrespected because of my age and gender and that he needed some training on working with female patients. I got a call back to reschedule, and this time there was a woman in the room. He scheduled me for X-rays and a magnetic resonance imaging scan. 2 disc fusions and a year of physical therapy later, I am finally starting to manage my neck pain. Story 20. I went to the emergency room presenting with excruciating head pain. A scan revealed bruising along my skull. I had not hit my head, and the pain was of sudden onset. The doctor was convinced my husband had hit me and refused to investigate further or even consider that my husband has never laid a hand on me. 6 years later, I underwent surgery to remove the mass inside my head, which was exactly what the first doctor had seen. The artery supplying the mass had long since lost the ability to drain, and I was months, if not less, away from a catastrophic bleed. Years of symptoms, worsening pain, almost losing my vision, and losing all of my hair were all because assuming my husband hit me was easier than following up on unusual imaging and labs. I am recovering well, and my husband still has never laid a hand on me. Story 21. I have an autoimmune condition. The first symptom I had was exhaustion, total body, tired to the bone exhaustion. I would come home from work, sit down in a recliner at 5 p.m., and fall asleep there until 5 a.m. I went to the doctor to try to figure it out. He told me I was too skinny for it to be thyroid-related, even though I had a history of thyroid problems. He said I was probably diabetic. All that testing came back negative. Then he said it was probably depression because women can be depressed for no reason without even knowing it. He gave me a psychiatric referral. I tried to explain to him that at 24, I had already buried both my parents. I knew the difference between not wanting to get out of bed and not being able to get out of bed. I went to the psychiatric appointment anyway. After an hours-long evaluation, that man told me that I didn't show any classic symptoms of depression, but he was going to prescribe me antidepressants to see if they would make me feel better. I told him that he could write whatever prescription he wanted, but I was not taking medication for something he didn't think I had. A year later, when the pain, swelling, and rashes showed up, I was diagnosed by another doctor with rheumatoid arthritis and a type of mild lupus. Story 22. Not quite on topic but related. When I was younger, my body was resistant to local anesthesia and required double the normal dose for the same effect. I was facing serious cervical cancer issues at the time, and my male doctor thought I was lying about my resistance or he did not want to pay for it. He performed a loop electrosurgical excision procedure biopsy on my cervix, which uses electricity to slice a piece off. I could feel everything and arched my back and screamed from the pain. The nurse had to use alcohol wipes under my nose to keep me from fainting. Afterwards, he called me a baby. Story 23. I went to the doctor for extreme abdominal pain, so severe that I could barely walk and had to stop working. They insisted it was lactose intolerance and said I was just being dramatic about the pain. I am lactose intolerant, but it does not cause pain nearly that severe. Turned out to be appendicitis, and I had to be rushed into emergency surgery because I waited too long to go to the hospital. The emergency room doctor diagnosed me in seconds after hearing my symptoms, which were classic signs of appendicitis. Story 24. When I was in my mid-20s, I had never even heard of sciatic nerves. One day, I woke up and could not stand due to intense pain. I am healthy and work out regularly, but I was so afraid because the pain in my leg and buttocks was severe. I had only been to the emergency room once in my life when I was little, for stitches, and it was painful enough then. This time, I decided to go to the emergency room immediately. I could hardly get out of my car in the parking lot. I was standing like an elderly person against the bed in the emergency room when the doctor walked in and said in a rude tone, "Why are you standing like that? Are you on your period?" I burst into tears, and he rolled his eyes at me. Story 25. It appears to be a minor infection, but since you will not be having children, treatment is not necessary. Story 26. When I was 13, I suddenly became very clumsy and started tripping over nothing and everything. People attributed it to puberty and my growing limbs, which seemed fair enough. A few months later, I developed severe, constant vertigo along with vomiting. I was out of school for an entire semester because I couldn't walk a straight line without throwing up. Several different doctors were consulted, and all concluded that I was a hysterical teenage girl faking it to avoid school. Finally, I saw an ear, nose, and throat specialist who examined my ear and discovered nothing there. No eardrum, no inner ear bones, no tissue of any kind. It turns out that the scarlet fever I had the summer before had destroyed everything and was still damaging my skull. I lost total hearing in that ear, as well as partial hearing in the other ear, because no doctor examined my ears despite clear signs of inner ear problems. Story 27. I had a kidney infection. I experienced flank pain on one side and severe fatigue. The doctor saw me with my head down and looking run down. He ignored my complaints about flank pain and severe fatigue and insisted that my issue was depression. I pushed back and continued to assert that my symptoms were not caused by depression. He was resistant to ordering a dipstick test to assess for a urinary tract infection. He finally agreed to perform the test, and I was diagnosed with a severe kidney infection. My mother was with me, and the doctor kept trying to justify why he thought it was just depression. He said, her head was low, and she just looked unhappy. Story 28. I had breast milk oversupply for months. I produced much more milk than my baby needed. It was unpleasant. I pumped a lot, donated a lot, and let my husband enjoy it. In a strange way, I was proud of how my abundant milk helped feed multiple children whose mothers struggled to supply enough. However, I was also in pain. My back hurt and I felt ready to explode. I mentioned it to my general practitioner during a regular visit unrelated to my milk supply. He refused to believe me, saying it couldn't exist because breasts self-regulate and only produce milk in response to stimuli. He insisted on weighing my baby to ensure a healthy weight. He thought I was underfeeding my baby. Story 29. I had increasingly severe period symptoms throughout my 30s. Every time I brought it up, I was told it was normal. I experienced back and hip pain so severe I couldn't walk, numbness and tingling in my feet, horrendous cramps, digestive issues, all the unpleasant symptoms. Being put on continuous birth control made everything much worse, causing bleeding 3 out of every 4 weeks. I finally found an obstetrician-gynecologist who paid attention and gave me an internal ultrasound. The diagnosis was many fibroids. I had a hysterectomy 6 months ago after more than a decade of dealing with this, and it was life-changing. I had endometriosis, fibroids, polyps, and adenomyosis. A normal uterus weighs about 70 grams. Mine was 160 grams. Good riddance. Story 30. Months of feeling unwell, coming off the back of a cold, turned into chronic night sweats, abdominal pain, and fatigue. Doctors just told me to take antibiotics and said I was probably perimenopausal. I am fit and healthy at 39 and had not seen them in 8 years. A rash and swollen lymph node appeared, but they did not consider it relevant to see me in person and asked me to just send photos. When I complained, they agreed to see me but only prescribed a different antibiotic and a stronger antihistamine. I pushed for blood tests and saw their expression change the day the results came in. Even then, I had to wait for a referral. During that week, I was in and out of accident and emergency with them dismissing my pain until a female doctor ordered a CT scan, which showed everything was affected. It still took another week and a half to get my diagnosis, including cultures and biopsies. Cancer. Hodgkin lymphoma, stage 4. But I did not fit any of the criteria for that. If I had not been in severe pain and visited accident and emergency, I do not know what state I would have been in waiting for that hematology referral. Story 31. A female gynecologist told me hidradenitis suppurativa was just unfortunate and nothing could be done about it. That was after a primary care physician insisted it was herpes 10 years earlier. Story 32. The summer I was 11, we were supposed to go to Disney as a family trip. I was very sick the day we left, vomiting and having diarrhea. We left anyway, and I passed out when we reached Florida. We stopped at the hospital in Jacksonville, and they told my mom I was just being dramatic and emotional because I was becoming a teenager going through puberty. I couldn't walk at Disney. We came home the next week, and I went to my regular doctor, who said it was a stomach bug. The following week, I had lost 24 pounds. They did an ultrasound and told my mom I had cancer. I had emergency surgery. I died twice. It was a ruptured and abscessed appendix. They didn't stitch it properly and used staples. It burst open twice, became infected, and now I have a scar the size of a banana fused to my intestines and an ovary. I also have polycystic ovary syndrome, and I know every time it flares up on the right side during my period. Story 33. Not me, but my mother-in-law. She was having back surgery and didn't really know how to explain things or what to expect. I went with her to her appointment. First, we waited 2 hours for her doctor. He was rude and very full of himself. He tried to rush us, but I had questions. He was so mad and red by the time he was done. I told him waiting 2 hours to see him didn't mean we were going to be cut short. Story 34. I am a husband who has to go to the doctor with my wife, who is not a native English speaker, or everything will be ignored. Not joking. The emergency room will provide proper care, but general practitioners and even the specialists we have seen just ignore her. If I am there, at least I can advocate for her. Story 35. I had strange, scary symptoms that started when I became an adult after being a fairly healthy child. I was dismissed for 7 years with comments like, "Women are all irrational and cannot handle stress. It is all in your head. You are young, so just deal with it. You just do not want to get better. I see patients worse off than you, so do not come back." Finally, I found a doctor who listened, truly cared, and promised to do everything in his power to help me. I was diagnosed with Ehlers-Danlos syndrome shortly after. I hate that it took so long to get an answer. I was really scared the entire time, thinking that I might be slowly dying. Story 36. I had been struggling with incapacitating periods that worsened over the years, to the point where I was in pain every single day of the month with nausea and chronic fatigue. I suspected I might have endometriosis, so I sought answers from the gynecologists at the public hospital I was assigned to. 4 years into the daily symptoms nightmare, after many inconclusive tests and imaging, a dismissive gynecologist had a 5-minute appointment to tell me it was all in my head, that I was perfectly healthy, and they could not help me, then dismissed me from the system. A year and a half later, due to delays caused by the COVID-19 pandemic, I finally booked an appointment with a private specialist. He diagnosed me with adenomyosis after a 5-second review of the MRI I brought. It was so obvious that we checked the radiologist's notes from the public hospital in my patient portal. They had been there for 2 years. Story 37. I was told my severe cramps and vomiting from irritable bowel syndrome and lactose intolerance were anxiety about going away to university. Story 38. A primary care doctor, who was an older golfing man, left me waiting in the exam room for over 20 minutes. He was already more than an hour late. I had the experience of listening to him on the phone with a golfing friend, planning their next golf trip. When he finally came into the exam room, he looked at my chart and asked why my husband and I did not have children. I told him we did not want any and said that I wanted to have my tubes tied, or my husband would get a vasectomy. He said, "Well, you will have to have your husband's permission to do that." I was in my mid-30s, and my husband was in his early 40s. Story 39. In my early 20s, I began experiencing intense foot, ankle, leg, and hip joint pain. I couldn't walk more than 10 feet at a time without crying. I got an appointment with the campus doctor, who spent barely 10 minutes with me and said I needed to exercise more. I tried to explain again that I could barely walk to class and started crying out of frustration, hurt, and feeling dismissed. He sighed, then stood up and left. His nurse came in to reprimand me for not listening to him. I got a second opinion. My ferritin level was 2, which means I had a dangerously low amount of iron in my blood. Normal levels are usually between 24 and 307 nanograms per milliliter. The doctor who ordered the test said my ferritin levels resembled those of a woman bleeding from traumatic childbirth. I was deeply frustrated by the first doctor who did not take me seriously or run any tests. Story 40. In February 2020, I went to my dentist and told him I thought I had an abscess. Symptoms matched, but he said it was just pain from grinding my teeth in my sleep and tried to get me to purchase a mouthguard for £300. I didn't have that kind of money to spare, so I declined. In June 2020, I went back. Same pain and symptoms, but more extreme. I couldn't sleep, couldn't eat, could hardly open my mouth, and no painkillers worked. He told me again that it was not an abscess, that it was from grinding my teeth, and I should have bought the night guard when he told me to. For days later, I took myself to the emergency department, and they immediately sent me to another hospital that had a maxillofacial department because they were 99% sure just from looking at me that it was, in fact, a dental abscess. X-rays proved that it was, so I don't know how my dentist didn't see it on the X-rays he took 4 days earlier. I ended up having surgery the next day after awake nasal intubation, which makes you feel like you're suffocating. It was so severe that the surgeons had to cut my neck to access all the infection, and now I have a very visible scar there. Thanks, dentist. Story 41. I told my doctor that I was repeatedly suicidal and that I felt depressed most of the time. I think I was about 17. He told me, well, some people just have that kind of personality. What a thoughtless answer. Story 42. Not me, but my daughter. The doctor dismissed my concerns about the lump on her throat. Her thyroid looked enlarged. They said it looked fine and were not concerned. I asked them to run some tests and they finally did. They called a few days later and said to get her into the endocrinologist as soon as possible because her thyroid-stimulating hormone level was 126. It's supposed to be around 0.4 to 4.0. Her level was 126. It was a goiter. She has Hashimoto's disease. I'm so glad I stood my ground. She is doing fine now but will be on thyroid medication. Story 43. It's just an ear infection. Are you just trying to get a doctor's note? Meanwhile, my undiagnosed lupus was causing kidney failure, inflammation of the lining around the heart, and recurring pneumonia. Thank God, after the 4th visit for pneumonia, I saw a different doctor who actually helped. Story 44. When I was about 12, I suddenly came down with a horrible stomach virus that caused major food aversions. Whenever I tried to eat, I would gag, resulting in significant weight loss. My mother took me to a physician who dismissed it as intentional starvation for attention and advised her to force me to drink weight gain shakes. From that point, I lost a lot of trust in doctors. My grandmother helped me recover by easing me back into eating solids and regaining a healthy weight. I will love that woman forever. Story 45. I have had back problems since I was a child. Once I became an adult and was no longer seeing my pediatric orthopedic doctor, I did not find a new one for years. I finally asked for a referral because my back pain had become significant after several years as a hairstylist. I went to the doctor, told him my history and current levels of pain, and explained how it had become significantly worse with my career, making it difficult to perform certain tasks on the job. I was literally leaving work and crying on my way home from the pain. His response was, well, it's not like that job is construction work. I don't really see how doing hair can cause back issues. Not only did he dismiss my pain, but he also took a dig at female-dominated trade jobs. Story 46. A doctor asked when my last period was and if my pain was menstrual cramps. The pain was in my upper right side under my ribcage and felt like a hernia. This was after talking to 3 women about my detailed medical history, including 10 surgeries and procedures in 3 years, as well as a full hysterectomy 2 years prior to this visit, for which I also provided records. Story 47. I had appendicitis, but the doctor told me I was experiencing ovulation pain. A few days later, my appendix burst, and I developed peritonitis. He could have easily sent me for an ultrasound to check it out, and I would have been able to have a laparoscopic appendectomy. Instead, I had to stay in the hospital for over a week. I was very sick and had a draining wound. Thank you for taking my complaint seriously, doctor. I could have died. Story 48. A doctor told me to rub vitamin E oil on my breast for a breast mass. I had stage 2 breast cancer with spread to my lymph nodes at 34 years old. Story 49. I went to the doctor when I was not feeling better after contracting the original strain of coronavirus disease 2019 in November 2020. He blamed my symptoms on my history of anxiety. When I returned after a couple of weeks feeling worse, he tested me for syphilis without informing me because he thought I showed signs of hysteria. I found a female provider for a second opinion. I was hospitalized the next day. It turned out I had bilateral pulmonary emboli, which are blood clots in the arteries of both lungs, resulting from my coronavirus disease 2019 infection. Story 50. My wife has dealt with chronic pain and fatigue for nearly a decade. Doctors just write her off and do not really try to help. She has been to every specialist in the tri-state area. About 2 years ago, I finally started going with her. She said the attention she receives when I am with her is like night and day. They have not solved the issues, but they take her seriously when I am in the room. The doctors instinctively look at and talk to me, and I tell them, she is the patient, not me. Talk to her. Story 51. You should eat more broccoli. That will help your suicidal thoughts pass. Ends up in a mental hospital 3 days later. Story 52. I had two frustrating experiences with a gynecologist. First, I talked to her about my anxiety about being able to conceive because I had 4 surgeries for my stage 4 endometriosis. She proceeded to lecture me as if I had never taken a health class, slowly explaining how sperm meets egg. I looked at her in disbelief. She then asked what I studied, virology, and continued to talk to me this way. She refused to help me with pain relief surgery because she didn't think it would help and believed it would hurt my chances of having a baby. My last surgery had been 5 years earlier and it did help, especially since I stopped birth control, which had made my endometriosis worse. The second time I saw her, I asked for another pain relief surgery. Her options were either to go on birth control to prove I was serious about postoperative suppression of the endometriosis, which I told her several times made it worse and made me want to hurt myself, or to have everything removed. There were no other options. She is the only specialist in this area who performs excision surgery and not just burning the endometriosis. The only other option was to go to Atlanta and pay $20,000. I told her I would deal with the pain. She shook my hand and said, "Let me know if you change your mind," then walked out. I hate being a female. Story 53. Had abdominal pain and discomfort for months, but I was also seeing the same doctor for mental health struggles that I have had my entire life. I take my medications daily, and everything else felt good mentally, but the stomach pain was attributed to anxiety. I went to urgent care when I collapsed at work due to the pain and found out I had a giant ovarian cyst that had ruptured. I dislike doctors. Story 54. I had pain in my lower back and thighs for years, starting when I was 21. Sometimes it was dull pain. Other times I was screaming and writhing on the floor. Multiple doctors over the years dismissed me, saying it was because of my period, weight, anxiety causing muscle spasms, perfectionism, hormones, being a woman, or it was all in my head. They gave me ibuprofen or naproxen and physical therapy, which did nothing and sent me on my way. I finally talked my way into seeing a rheumatologist. In one appointment, he performed a simple physical exam and an X-ray and diagnosed me with arthritis in my sacroiliac joint. I started on a medication and my pain disappeared. I had been suffering, tortured for 10 years, and all it took was one doctor to take me seriously and do a basic test. Story 55. Allow me to share a review I left regarding a visit to this doctor. I do not recommend Dr. Name. I saw him for a large hematoma on my breast. He did not leave the room to allow me to get undressed, nor did he provide a hospital gown. Instead, he had me expose my breast for examination. This was unacceptable. He used the words flopping and swinging, even though I told him several times that there was no impact to the breast. As a breast cancer survivor, those are loaded words. I neither flop nor swing. My reconstructive surgery was excellent. Using words like that on a female patient is inappropriate. Similar to a female doctor calling a male patient undersized or flaccid. He has no interpersonal skills, at least where female patients are concerned. Do not see this doctor. Story 56. My gallbladder ruptured and my organs were shutting down. They told me I just needed to relieve myself. Story 57. I suffered from Helicobacter pylori for 5 years. The pain left me screaming in agony daily during the last couple of years. I dragged myself to a self-pay doctor because I don't have insurance and can't afford it. On the 3rd day, I couldn't drink water or even swallow my own spit because it was so painful, and I had been spitting into bottles. The doctor took about 10 minutes to diagnose me, but she did test my blood, something the emergency room my mom took me to when the severe pain began refused to do. After 2 days of antibiotics, I started to feel better. I nearly died of dehydration. Instead of receiving proper care, I was seen as drug-seeking and given a magnetic resonance imaging scan that cost several $1,000s. The doctor who helped me was shocked that they gave me an MRI without checking my blood for anything. She said, "We're going to actually test you for things here." Story 58. If psychiatrists count, my attention deficit hyperactivity disorder was dismissed as depression to the point I developed depression because of how badly I was failing school. My attention deficit hyperactivity disorder is severe. and it was to the point I could hardly do addition anymore because my mind genuinely would not stay still. I was constantly exhausted and tried to end my life over it. They put me on bipolar medication that caused me to have tics for about a week until I stopped taking it. Finally, I was tested and put on proper medication. I am now in a special needs school and top of my class. Math is my best subject. I just wish they did not keep dismissing me because several teenage girls have depression. It is probably what I have too. I was at a second grade reading level in 6th grade. Years of my life were wasted thinking I was just stupid and beyond repair because they refused to believe anybody besides 7-year-old boys can have attention deficit hyperactivity disorder. Story 59. It took me so much time, tears, and money to properly treat an ear infection. If I received $1 for every time a doctor asked, "Did you go swimming?" I could buy a house. Story 60. I struggled with depression in the years after a challenging multiple sclerosis diagnosis and had difficulty adjusting to life in general during a tumultuous period around ages 22 to 25. My neurologist, a female colleague, showed me the new lesions that looked like neon buckshot scattered across the top of my brain MRI on her computer screen and discussed them with me. Immediately after, I expressed my concerns about my mental health and depressive brain fog. She asked me, "Have you considered eating more raspberries?" When I left, I declined to make a follow-up appointment and never returned. But I wish I had the courage to confront her about that. Story 61. 1996. When I showed up for a mammogram due to a lump, the woman said, "We don't do mammograms on 30-year-olds. I had to tell her my doctor ordered it, and I was going to get it. 2019. A female gynecology nurse practitioner, young, shrugged her shoulders at my 14-day periods, during which I had to wear adult diapers for the first week. I dislike that offices make you speak to 3 different people before you can speak to your doctor. Story 62. I asked for medication to help ease depression symptoms that were getting worse. It took a lot of courage to reach out for help in the first place because I was ashamed. The doctor looked me dead in the eyes after I explained how bad things were getting and asked, "Are you sure this is not because a boy broke your heart?" I never mentioned anything about relationships, and it was most definitely not because of a relationship. Story 63. A male gynecologist scolded me for jumping back as if I was in pain because, according to him, I was feeling pressure, not pain. I never would have thought the sensation of burning knives on my genitals counted as pressure. But sure, dude, I did not go back. Story 64. I had severe endometriosis and my periods were unbearable. My doctor put me through procedure after procedure and would not consent to a hysterectomy. When he finally did, reluctantly, the hysterectomy took many hours longer than expected. When I woke up in the recovery room, he was holding my hand and said to me, "I am so sorry." It turned out to be the worst case he had ever seen. Story 65. I contracted a methicillin-resistant Staphylococcus aureus infection in my nipple after giving birth due to raw nipples from breastfeeding. My doctor kept telling me it was normal mastitis and to keep icing, even when my skin was peeling off. The pain became so unbearable that I finally went to the emergency room, where they gave me antibiotics and tested me to determine the exact infection. I will forever resent my obstetrician. When I informed her of the diagnosis at my 6-week follow-up appointment, all she said was, "Oh, that's weird." Story 66. You are not depressed. You do not need antidepressants. If you just stopped taking birth control, you would be fine. I sat sobbing and feeling suicidal in his office, begging for help. He also recommended high-dose vitamin supplements and conveniently gave me the address for the website where he sold those supplements as a side business. Story 67. I have a very high pain tolerance. I went from maybe cramps level pain to not able to stand without crying in about 3 hours. The young male emergency room doctor asked if I was sure it wasn't my period. If I could have, I would have launched myself at him. Story 68. When I was 15 or 16, I told my doctor I thought I might be bipolar and described all my symptoms in episodes. He told me I was just an emotional woman. 10 years later, while in a partial hospitalization program and after years of mental health crises, I was diagnosed with bipolar disorder type 2. The same doctor who dismissed me overprescribed Tylenol with codeine and Xanax for years, which caused other problems. Thankfully, my insurance changed, and I had to switch doctors when I was about 23. Story 69. I was having stomach pain and digestive issues, including severe cramping that made me lie flat after eating. I finally went to the gastroenterologist, only for him to say that I looked too good to be sick. When they scoped me, they found that I had polyps, an ulcer, and a herniated diaphragm. I suffered for too long because I was tanned and fit. Story 70. Pain in groin and pelvic area after marathon. The healthcare provider said I probably strained a muscle and should stretch more. I stretch a lot and am in great physical shape. I also mentioned that the pain started right before the marathon but got much worse around mile 8. The provider said it could not be a serious injury since I finished the marathon and did not want to do imaging. I went to a different doctor a few weeks later and was diagnosed with a complete pelvic fracture. No wonder it hurt to walk. Fortunately, it was not life-threatening, but it was painful and delayed my return to running and my next marathon. Story 71. After my 4th child, I had sharp shooting pains in my stomach. It felt exactly like when I had a uterine infection after the birth of my 2nd child. My obstetrician told me to go to my general practitioner, whose office was closer. I was told, "Sometimes things hurt when you have a baby." I walked around like that for 6 weeks until my husband found me curled in the fetal position on the bathroom floor and took me to the emergency room. It was a bladder infection. Story 72. I was hyperactive and able to do things like 2 back-to-back night shifts at the hospital as a healthcare assistant, have about 4 hours of sleep between, and run a house with my husband. Then I couldn't. I was tired all the time. I slowly had to have 2 days between shifts, then 3, then 4. I kept being told, "You're a mom. You're meant to be tired. You're a worker. You will be tired. You're depressed, so it's tiring." Well, my dad was diagnosed with severe sleep apnea to the point they were going to take his driving license away. He had a continuous positive airway pressure machine, so I inquired with my doctor if it could be happening to me. I was told no, I was 25, female, not likely, pretty much impossible since the average person with sleep apnea is a 50-year-old male with a pot belly, and I was a healthy weight. I bought a device and measured myself. I dropped to 89% oxygen saturation at night on multiple nights. 2 years later, I had a continuous positive airway pressure machine, as it took that long to be formally diagnosed after a late referral. That's just the beginning of my story. Since then, I've been diagnosed with chronic fatigue syndrome, complex regional pain syndrome. Apparently operations hurt, so I had to deal with burning nerves until they realized it wasn't getting better. Inappropriate sinus tachycardia. This month I told them I kept having palpitations, so rather annoyed, my doctor referred me for a 24-hour electrocardiogram. It came back with 185 episodes of tachycardia over 150 beats per minute, and I don't walk due to my disability. Gaslighting is basically all I have ever got. If I hadn't helped by gathering proof and self-diagnosing using the guidelines, then presenting all my findings before I got a referral, I would never have had any formal diagnoses at all. Believe it or not, my rheumatology referral has been rejected a 4th time this month, as there is no evidence my joints are bad. Except my foot, ankle, and hips collapsed and became unstable at 27 years old, and 4 subsequent surgeries have failed. Oh, and the chromosome abnormality that causes bad joints. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.